Area busuafo ye da mo asese mo atwan ame adan ho akwa ba fe ye de apomuden komo na ebremo ansa na no ma ye ma dofo echi nkwa enti sweet wo faase eja kwabena wo faase Abigail ohini brenya ene eye wawoda ofa eja kwabena se o ma happy birthday nyame enhyira abi na wonye wakoma so ade nyina emfama nti ne kra wo faase ano birthday no ne kra ne se nye se eja wama abi sweet vibes nti eno anu no hey Abigail oboa koyere no naje wate kodan ne kanaje madam Fosika maame madam Fosika me nkwada ne baako wonse me wo Dr. De Papa na me wo sika opokunsia sika maame me ma wachi o na wo ho tesen bibia aboko sika kina farmer emse meka ne se be easy pa ma fisika ne bra anope me chia wo mu na ma chia madam Fosika maame nso na ye bra peni baako ura Steve Dilabi ono na wo Paddy's Night Club ura Steve Dilabi kafra ura Dilabi wo maame afri mu ya nti weekend we wo edukrum ekwapem edukrum ye beba bijaw na waye o maame yi kama nti abusuafo mo amunim Paddy's Night Club Steve Dilabi no ye bra peni no na ne maame afri mu nti wo edukrum Friday ekosi Sunday ye kata oba peni Mercy opare ankama echi ti mo amunim no muma ye nyina ye mom ne nkogya no ono a enka obeba ene ma eyi esoye why ye da mwasipa ye da Amen Scientific Care Bar ne Alternative Medical Hospital so ase na Amen si enkanche mu se free medical screening no mo ba ya buso macho wacha afi mu bi ohono mo a Jordan a wo wie ni sei na ese ye sign e ba sa no na aha shake mi bonsu pa se me ana me se mumra ti waye ni se ya extend no nti si anu si atoma de akwakosi adwada biem 15th November nti me se sabre de contem mon contem na we de si a ehumobro e no de extend no to me extend ni biem otena se 7 am ekosi 5 pm adwada kosi memenda kosi ada 11 am ekosi 3 pm kaisa akra de no branches mienu na dome de na Benz net flat ono e na klagon so e ben under bridge no na e wo lashibi ashaman kwantimpon ni so no nti okwa onim se yemendi o free screening oye thorough one if you tisu kosi ukokromuti so obeye ni nyina ama sikatua bia ne wonye okapre emom se aduro bibini no ohu yade bi na ohia adura eno kra nso oju bibi ketua bi fra wonum 0207229505 and 0244227192 and 0245275254 Kojak say enkanche mu se woda mo ase papa won wodi kan di bidie eye toothpaste said ye tete ne ye de to brodua sotwe yese no wo manim difo koye nhwehwemu no hu se saida eye enti yenwusu na ene no niam asesa enti waye na befo kwanso wodi ye toothpaste wie no mo maka nyina ehwe no asua no nanso de wo sua wasa no wo chia ne pa wontumi nyama na nyese koja charcoal toothpaste da enti kodwa so na ohwehwe toothpaste charcoal de na aba na ma wo si ye fite na wonum so ye hwam na bose ho ban na ba che wo busa kojak charcoal toothpaste ebo no so de okita 2 cedis kra wo benya bi wo kojak ye toothpaste no na osan wo ba ko bi a mo a onum nso nwunu ana se wodi aduane a nwunu a na o si ekiki mese no ekiki mese ade hu si ebetu de bi mpacho uhia kojak PNF eno nso beboa wo na siesie o se de wo de wo huru wanum a kojak PNF mouth bath na odi agirejina wonum awhoro wonum kama pa o kojak toothbrush enso ho se unim procode se yetipaya kojak eno de procode aba okoni eyifufuro bia ma o se da bi mepe procode de efri kojak no ba bi eton ro bia pharmacy chemical shop drug sellers bebia ubenya kojak enupai bi ewo ho o se kojak products de quality no be problem kra into kwa abontia kodwa so ahwehwe kojak ni ama Dr. Davis Kofi Adeze and a consultant gynecologist and obstetrician ɛwɔ Mary Lucy Memorial Hospital waba ɛnɛ de yɛnka mmaa asɛm na mmom adeɛ baako a ɛka mmaa ɛka mmarima ka ne yesusu akora ne anim sɛ o ɛyɛ mpanin yadeɛ ti na wote sɛ asi o akwada eti wanya diabetes akwada ketewa sei esi o nti yɛpɛsɛ yɛdi nkomo na yɛtwe adwen kɔ so kwan yɛbɛfa so a stem cell yɛbɛtumi di aboa na yɛde asosɔ yɛ diabetes ano efisɛ November busumi die diabetes nkomodie yɛtwe adwen si so na aboa yɛnim sɛ enye yade a yɛkasa yɛsa etu ase na sɛ wo suso anu ye a wobɛsoso ne sɛn na ankwa ankosesa na amfa asɛm ama doc akwaba
na
ni nyina megese doc anopensi da ase papa wo so ayefe atade ne fata ododo
kama
me da ase doc mi musa se diabetes no asiche yade se de ya ye kanon aye huhuhu sa wo wi ase wo hu
aye huhuhu pa na yare a ekese my friends one of the commonest yare a nipa wo ewiase mu.
Oh, okay.
Yeah, now the last as a 20 a film, almost nipa 420 something million, and just more diabetes.
Oh, wow.
We have yeah. Now by side, how we say time checking to be or moving so no money. Until just a figure no plano.
A bit to me, I'll be on necessary. Oh, okay. Na denti na way ho ayenim den ye nya diabetes no.
Right. So even your diabetes mo ahoro miensa.
Okay.
Na type 1.
Okay.
And let's just say and type 2 and a pin for the answer gestational diabetes.
Okay.
Type 1 no. The diabetes and cancer just sugar cholesterol.
Okay.
Na organ be what you might friend pancreas. And also pancreas no hormone be friend insulin. Into insulin no and regulate and the sugar no then editing.
Okay.
It is insulin no pancreas then to be insulin no papa. Na ama diabetes and just sugar no cholesterol because insulin is swati and I say a bini okra into the warm insulin. And then type 1 no. Na say type 1 no and no in pre-P no. Na immune problem. And immune problem just say nipa ni body ankasa no mount some immune reaction to the pancreas to cells na pancreas no. Yeah, for autoimmune just say sometimes we me call wrong ema ono any body no attack ekuntia no ankasa ni cells.
Oh, okay.
Yeah, into type 1 there no titu no and it be genetic e be na the wo no so.
Okay.
Yeah. Now type 2 no there na most of the time lifestyle. So we putting on weight. Be overweight. We need exercise. We do any day so emunye. We no monsa cigarette. And it be so na family no nti obusu ani bi first enya wo so tumi den enya sa diabetes ni bi nti combination of factors na etuma enya diabetes
na adenti na ye kan se esichire yade if say ebi wo perception say ne medi esichire dodo ama na boro so ti e osi oni emi ni esichire bi mate mesichire die so.
Well, esichire yare ni nti your friend esichire yare nke say wo say esichire no ka normal level be ewe mu obia hia sichire kakra ewo ne mu.
Okay.
But say tra level I say one na abroso sa na any friend diabetes no na ebi so once na be broso dodo no e cut through stage be friend pre-diabetes and type 2 diabetes ya king and we cut through phase and just pre ko anaba in pre na ya na from if normal na call stage I friend pre-diabetes na hono wa nhwe ye na wa hu a na fa chire no adane diabetes ankasa na je senti sugar e wo nipadua no ankasa na edinam moja no no e dos dodo nti na fa no chire yare na je se enche da nchire se sugar no we dia ma na abro so nti na aba sa na emo sugar na e wo mu no e na akosoro because what me this sugar cry that say wo pancreas any wo cells e ye adwuma yi it me ema insulin no so e ye adwuma yi wo sugar no be normal but say do baby that say insulin cells no enye entime respond to insulin no wo say insulin na ma cells no use sugar no it is cells no after entime use entime respond to insulin na every insulin insensitivity na just say ma insulin entime nya dwuma yi so even though say insulin level no normal so cells no respond to insulin ma take sugar no in until ma sugar no enemu bebre.
Okay, apart from type 3 na eye apem for the onyema na onya no mienu na edi nkan no ye wo omo a eheda ye wo mo won se kanene nim so ye say empani yade but then say entisa nche wo groups of people a enya omo na e beka so omo ye more at risk kana
more at risk so yes what about age so e kan your body ye nyin na ama your cells no tell bia na respond to sa insulin ya kan ho ye nti age a factor na obesity and as overweight cry no say wo stradinam fat dose dodo a etimi ma say sa insulin ya kan ho asemi no etimi cells no respond to insulin ye na ma sugar dose bebre wo mu na ene bi no so onye exercise because onye exercise it mean ma cells no use insulin ye e ma cells no use sugar ye it say we dormant na won ta nye exercise and also ebetimi ama say we at risk of developing diabetes.
Okay.
Ebi so family the fact say the family mo diabetes e family no ebetimi den anya diabetes ene bi no so apem for no bi so wa we bibia no onya diabetes onyim ebra onyim na onya diabetes no owuya normal improve no go back to normal but ebinum dey na
enko normal
na wachinsem na aye diabetes
okay ntinka gestation na abeka ho I see say ye manage diabetes ne kwan be akwa hodo be ne faso manage
right targeted yaka diet nsem with eduani diemo very very important so the right at some point maybe I'm discussing diet management busumi mo diabetes month
yes
into diet important the right diet say dietitian but say we eduani also di and say necessary udi into no diet is very important. Exercise, lifestyle modifications. Tembia say nanti akura na 19 tem dey be akura by 30 minutes and I say 5 times in a week 30 minute session each time kura na et me boy Emma cells no use sugar no ye.
Okay.
Into the diet is very important. Exercise the uno say so we dem woteso ujai kura no unja tiso kura bebre. Then into interventions at me most of the time no sugar no control better.
Okay.
Na any enro so a control diabetes.
Okay.
Na enro no what it does is say cells no na atuchima ena wa man eduro no boa say sugar no be cut down but cells na atuchima na diabetes abano eno no ho na da na say west into diabetes unya pe na say lifelong treatment the entity say we cells no are starting some time normal after do stage bi na cells na then atuchima and me use insulin bio insulin resistant so and now that's for the type 2. Now it do some stage after the insulin is normal, so still our sugar high. Never we draw sugar no so better. But cells now I teach man diabetes about it, and it's our process in it continues. That's why you have to be on drugs.
Yeah. I see.
Yeah, but I say
time ben na stem cell
yes, it's saying who say cells those cells can be reversed. I could back to the normal state and once on your diabetes.
Any senator say ya cure no ana.
Yes, it can be cured.
Wow.
That's the stage. Yes, the entire it is an say. One say, Nyankupo ankasa obo ni pa. Say na hospitals ni ho. Ana. Another hospitals ho.
Oh, that's why you need a hospital.
Na hospital no na nro ni ho.
Okay.
And about Adam and Eve, what do I need hospital?
Okay.
But
we say stem cell treatment for diabetes.
Yes.
Okay.
All right.
No chain.
Yeah. Into no young Cassano, Yankupa my cells, teach you be stem cells.
Okay.
Now stem cells are the center or the cell of healing.
Okay.
Whether say Uhubeto and Hunton, depending on your stem cells. And no, I know the eboa to aid the process.
Okay.
But the actual healing effect, are stem cells. Aha. Into stem cells, you are packaging in certain areas. So, you say, okay, stem cells, a bit of you use, ultimately, stem cells, no, now process here. Who's not the chain for the animal? Baby, and cells are a touch my answer. Either cells are deteriorating, I have a problem, piano. It means SMR cells no adding. Ever back.
Oh, really?
That is what stem cells do. Yeah.
No. Nipa no what diabetes na ne ho.
Ne ho ono cells.
Okay.
And yes cells are if you was stem cells na ho ebi o ho a you have embryonic stem cells. You have say about fry and no ethically no say right. So
okay.
Akala. And ebi no say free umbilical cord. A chair the placenta and umbilical cord. Yet me trace how much any stem cells being. Yes.
Okay.
And also not just say one cause stem cells and you'll be stem cells.
Okay.
But when you make autologous, not just a wow body stem cells. Picture na buy no so we bone marrow and we say we do bone marrow just say don't pay no marrow I want so don't pay fat na woman.
To say we aboa de na de ya ye fefe no to say the dead bi no.
Yes, I don't know stem cells are rich a woman.
Okay.
And I say who say adipose tissue I find fat. Ankasano. Stem cells be brave. E wo ho enye
Oh.
Into what me yet me stem cells no. Into wo hwe arrow na ekọ ho na just test tube no. O ma twa gum. And o ma process it, isolation. And after the omo man as a drip. Right,
I say you bone moja.
Yes. HS stem cells no mo dey good drip mu. And
omode bono
back.
Nti ne mfa ne say we ye dey treat diabetes pepepe. Sa no obeye ne da bia. And obey ni weekly bia and oye no mfie bia wawie.
Okay, nti say I'll come to the question.
Yes, doc.
Was that way fat?
Aye.
Sadinam.
Ekita no no
sradie no. Actually, yeah, who say nya bebre kra. Test tube ni ekitwe bi.
Okay.
And actually sadinam no hiding. That's a fat na gum.
Okay.
Then the next picture into be separate, e be digest it as separate.
Okay,
afi wo hwan yikitikiti na wo tube na se no as kokobi kakra no.
E sha no ho kitikiti no. Baby a ho twa vin no.
Yes. And stem cells.
Oh, baby na de enya fi mu
ano. More than almost 30 to 60 million stem cells and a small
baby a da red kakra bi no. E no kra e faint kakra.
Faint kakra, yeah.
Okay.
And only stem cells no. Intend we shed drip more. Na the man that says our cells be baby are making 30 60 million or 100 500 million cells. We the flood in the system now. A mass cells it works on the cells at which many na. So that reversal process, yes. And what drip ma yes.
Oh, okay. Inti mo twesrade ni bebre na stem cell na obenya ne sa kakra bi no. Na sa kakra we no, e betumi treat diabetes no for how long?
E betumi treat diabetes no e been there for very long time, 10 years more or sometimes even for life. Ebino at me, Syria or maybe 10 years, no, 5 years, no, years, and then embabium.
Oh, I see.
But normally, 5, 10, 15 years.
It's Saka Crabby way, say, and funny say, Obiaba, I go through all the processes. BBI, okay, actually, and yase, yet the abono, say 2021, yimwa. The abono, November 3, 2021.
Yeah.
Obesia be bobium da bain. And obviously I go through procedure and beam that.
But fear, thereabouts.
Oh really?
Yeah.
Nti enye se obi a wabe first ebi a waba 3 months time it's a sign bra na yen sign twin fat tissue na yen sign processing stem cells
because so unya enough stem cells that's it say can na eno one time treatment. Yeah. Nti the nya say ebi a dey okay and afi bi a check.
Okay.
Yeah, initially say okay yeah check your sugar no yen hwe check your
Okay.
sugar you do some stage na with me giant don't cry no check. Yen here say we monitor.
Oh.
So we monitor.
Okay.
Yeah.
I see. Nti when you type bi a to say type 1 type 2 any type 3 a bi a wa wo awie but that's all.
Yeah.
And na ye ma omo and I say obi a.
Yeah, one thing about stem cells is say in fact the type.
Okay.
So cells na are wrong and stem cells correct cells are wrong. Nati to type 1 aye ka say most imprepi na aye immune system na kasa na attack cells na eyipan insulin no. It mean emasa immune process no reverse my cells no esamba back to normal.
Oh.
And type 2 no so cells are intimately responding to insulin no it mean ma after cells no eye adwuma tse na ese adwuma.
Wow.
Yeah.
Nti omo de won say ebi manya diabetes na ma additorate bi kra na o de wanya kuro wom. They say diabetes kuro de enwu da o.
Yeah, so they can stem cells correct diabetes. And more importantly, complications of diabetes and so stem cells at me correct.
Oh, sir.
Yes.
And yes, diabetes ne keke, but even complications.
Even the complications.
And not just a cruel kahon.
A cruel kahon. To when you cry, yet me the diabetes, stem cells, at me my chronia then. Because the stem cells heal, and they're the healing cells. So cells not touch man when you cry.
Doc me bow.
Yeah.
But your a cruel part, the other one, where diabetes.
Diabetes.
But your fan chair, more moody dear, Yama Janina, Abomanuma, Yajama Bofuno, Monfanche, Pacho. Inti where stem cell before the stem cell no ye mukroneni and now 1 week after the stem cell me ho me the end results na share say kwata we
okay towards the end
okay afi who say ani no kata ewu ba
say skin hunam flesh no so kata cells no then building new cells kata completely building
with
new,
that little stem cell now you
yes exactly with that little stem cells now we inject it a chronoma and mast cells a what a chronomy then into vessels intina supply mamoja eba a chronomo emu then ebie intino also before benya complications from diabetes no na blood flow vessels no emu then emu esi anase yes, so narrow. They just say, "Emma, I have vascular, complications." They just say,
"Emua kra." As a point point, she dey nim papa.
Into me, Emma vessels, no, then emu then ABA, and Emma cells are a chrono, hunamno, and so cells no, any fufu. It means replace cells no. Stem cells now it me change, and replace the damaged cells. Into say, if I diabetes, muna unye ekra, cure diabetes no na cure ekro so
wow
so na emphasis a kidney damage and when yet me the stem cells then treat kidney as well as diabetes no at the same time into treatment back no it just complications so then complications so et and after so complications in by na reduce with chances of any complication as you then as so stroke and if you say even diabetes through diabetes so much meaning hypertension that stroke and also no stem cells at me emma cells na wo ya dream na atuchima na when you stroke no it can be regenerated into regenerative medicine
into ebra me stem cell no make me afa me regular because ebia ye nim say diabetes ye won insulin no nkonya ne ho ti wo befa wunro na ofa ne dada no
yes wo befa wunro na ofa ne dada na up to a point
okay
ebinum there are people who have had response after 2-3 weeks ebinum so 3 months obi ade ne there into wo befa do some stage na that feels okay jania monitor ne yenhwe say sugar no e ko ne sen ni hia say wo be monitor so It's a story be adjusted dosage, you know.
Okay.
To the point we should not say yeah to me
and you're managing diabetes, no, enka stem cell be the best option compared to the other forms of management.
Well, managing any disease, stem cells is the best option because it's the center of healing. And you know, you see, one thing about your man and don't treat symptoms, it treats signs, but it doesn't really treat the root cause of problems.
I see. Now, and stem cell no better you.
A prayer you say you have antibiotics, maybe.
Yes.
You have dressing.
Yes.
Need you just infection and more everything.
Bit me
up. But say cells no can boom now healing. No, stem cells no and they healing.
Oh, okay, yes, that's great.
And then during the healing, it paves the way for the stem cells to work. Now, because when you have infection, healing no end when you're there. So, antibiotics, dressing, any like I said, now more clear.
Yeah.
Okay. Then the stem cells can work and repair and mend.
Oh, I see. Nti your best stem cell, but it's a wukro no dia, we befa wundo na up to the point.
Yes, up to the point until monitoring. So the monitoring is the key.
Okay.
Go there, monitor with sugar.
And away so a science, and your herbal.
There be a pure science.
A pure science.
Understanding of how the body heals.
I see.
Yes.
And also any homeopathy nibia.
There be. This is pure science. We see the way we heal. Unye kro bibi twa wa kro no be wu no. You who say, oh, okay. If then what causes healing? And you say stem cells. And the healing, and that's how God created us. What the man say? Because one created and say any antibiotics as a result of human development near environment near you more the and I must say
stem cell so we muda that didn't any that you have to go through some medical procedure.
That's a very good question. But also you already be stem cells. No, most tissues are stem cells. In Tiafan say hunami say bibi twa stem cells are on and say the money but it tell you so na the problem is so big say stem cells never on kwano
into me
I just
okay
and then the extra stem cells who harvest echo can
one na itimi aye
exactly.
I see and you ni bo be den
and you bo nya we share the benefits ni if I say bia your quality of life. If I say you have diabetes, look at complications and then FM enya who find no still out these complications. Not treatment be where it has potential and it can even stop you from taking medications and reverse with cells to where they were before you got diabetes. Not just your risk of getting stroke, your risk of getting complications with kidney problems, your risk of getting complications with vessels, ulcers, when you will be a problem. Then the risk of some problem, neuropathy, tingling, all these risks is prevented and is reversed.
I see. And you be a stem cell treatment, a common organ, sir, na we
and common, but it can be done. It's available.
It's available.
Yes.
I like that. Very interesting. Doc, I was said that could be mobana. Yes, because it's him say stem cell no so about be alternative form of healing. Yade bian so ye betim the stem cell no aka ho. Enti that chin bia ye beba na yasan ahwe bi foforo but me sure say ye hwehwe doctor ye be call Mary Lucy Memorial Hospital so de odi ho nkomodie na dwosuo no ono ankasa sa stem cell dwumedie no ebi
but me cheche you kakra we say a plant stem cells bi so ewo ho.
Oh, I see.
And BB cider. Plant, right. There's something they call plant stem cells.
It's a plant, and so you're a living organism.
Yeah,
so obviously, I know so about stem cell.
And also what stem cells, but and no stem cells.
No.
And then you cry about muna, and no a mouse stem cells. But what it does is it is a fruits are with as our nutrients, free fruits, a mouse cells in the year. Healthy.
Come on.
Yes, that is how plants. It is just like so we did in a very healthy way.
Okay.
Yes, with the
fruits, vegetables.
Yeah,
5 you need pedia.
Yeah, we need a 5.
Yeah,
that is the ultimate.
Okay.
Yes, because you are trying to encourage your stem cells to work, but here we are actually mobilizing.
Okay. Yeah, boa stem cell na we ni pedua ni mu no.
Yes.
Na ye dia akosa ya de no.
Great. No understand ya bia we mu.
Intimpacho the akamu awenya no, just contact Dr. Davis Kofi Adeze, consultant gynecologist and obstetrician, Mary Lucy Memorial Hospital. Doc no pay ye dasi pa. Pacho ye kwa ba ye be di Ghana enkomo twen ye wadaruma ye basisia.